Hello, KMC University clients. My name is Dr. Richard Mason, and I'm a chiropractor who recently was added to KMC University's array of consultants. And my particular job is going to be focusing on clinical certainty and diagnostic acumen. So today, in this help desk episode, we're going to talk about differential diagnosis and the importance of why it needs to be in your SOAP notes. Differential diagnosis is critical to the chiropractic doctor because it gives the overlay and the kind of the 10,000-foot view of what's going on with the patient. So you take the time to do a good history and exam, and that should give you a diagnosis. But many of our patients are complex. They have competing diagnoses. They have lots of different symptoms that are overlapping one another. So you have to have a way of parsing out those diagnoses and putting those diagnoses into your assessment. So let's say you have someone with low back pain and they're having radicular pain down to the knee, but not past the knee. So typically sciatica is pain that's past the knee, true sciatica. But there's a lot of different things that can cause low back pain and discomfort and pain into the, let's say, the right lower extremity. The structures that can cause that are the lumbar facets, the SI joint, trigger point in the glute, piriformis syndrome. So those would be 4 diagnoses that need to be in your differential diagnosis, so that as you go through care, hopefully the patient's getting better. But if they're not, then you can start to look at, well, maybe it's not the facets, maybe it's a trigger point. Maybe I should tailor my treatment towards that, because you've already thought of that in your differential diagnosis. So it gives you understanding and a concise array of different findings to know what to look for next. And this is important for a few different reasons. Number one, it improves clinical certainty and it reduces the confusion of what's happening with the patient. Number two, if someone, you were to refer a patient out to, let's say, an orthopedic surgeon, and you're not able to help them, they're going to ask for a copy of your notes. And you want to see in there that provider, that you can see what your clinical reasoning was. It's especially important when you have a relationship with a provider and you may be getting referrals back and forth. And the third reason is medical legal protection. If someone comes in and you diagnose a disc herniation based on their subjective and objective findings, and then let's say their care doesn't help, or they get a little bit worse, which sometimes happens, they can't really come back and say, you caused my disc herniation, because you've already diagnosed it. So that's important to put in there as one of the differential diagnoses. So I hope this help desk episode was helpful, and look for more in many different forms through KMC University.